Hello, this is Dr. Patricia Coughlin. In the past several videos, I've been focusing on common mistakes and pitfalls in the implementation of ISTDP. Today, I'm going to talk about how to get the process going in a positive direction, even with difficult patients. This often involves identifying character defenses that left unattended will actually prevent the development of a therapeutic alliance. It's important to remember that the alliance is just as often the result of therapeutic intervention as it is the cause of therapeutic change. So, what do we mean by character defenses? These are rigid and habitual ways of being that permeate the patient's functioning. So it could be anything from being very emotionally detached, being intellectualizing and ruminating about things, being helpless, hopeless, passive, having an excessive external focus, seeing the self as a victim, as their whole life simply being the result of external forces and no sense of agency. So these character defenses will create, as Reich pointed out, a ballast which will become difficult, if not impossible, to penetrate, if not taken up early on in the treatment. I all too often see supervisees coming in with sessions like 20 or 30 sessions in, and they somehow are trying to work on feelings and conflicts when the patient is using character defenses, right? They're completely detached, passive, in a victim position, and so on. So, in order to really get the alliance going and to do anything we can really consider therapeutic, you must take up these characteristic, habitual modes of being that are largely defensive. So today I had an example of that in a supervision where the patient had an external focus. This man thought that both the source of his problems and the solution were outside of him, that he was simply the victim of circumstance, the victim of other people who don't understand him. So, given this, it's no wonder that he was anxious and depressed and kind of hopeless and helpless, right? So, your job is to help him see that by focusing outside of himself, he renders himself helpless. It's no wonder he's hopeless, right? He's setting himself an impossible goal if what he's going to try to do is change other people or circumstances. And at the same time, he's inadvertently ignoring himself and not taking any kind of charge over what he actually has some control over, which is his own feelings, attitudes, and behaviors. So if this externalization is not taken up in the beginning, if you don't help the patient see that that defensive position is creating and exacerbating his problems, and that unless he gives that up and is willing to look inward at himself and what he can actually do, then there is really no reason for therapy. Okay? So leaving externalization in place and just going for feelings toward other people when the patient is in a defensive position of the victim, I think you can see is not going to help him change in a therapeutic way. So character defenses are not defenses that you can bypass. Okay, so sometimes we will bypass, if you will, or not take up defenses in the very, very early part of the treatment when we're just trying to get some understanding of the problem and do an inquiry. If you can get an inquiry without messing around with defenses, then do it. But again, these character defenses often show up right from the start, right? Where again, the person would simply complain about what other people are or are not doing. And since there's nothing that either you or them can do about that, I think you can see there's no real basis for therapy. So you can either, say something like, I understand it sounds like, your husband and your mother and your son are all having some difficulties, but you're the one who's here, you're the one I'm interested in. And so I'm wondering what's the difficulty you're having in dealing with that. So you want to keep inviting curiosity and introspection, right? It's only if the patient can, with your help, identify a problem they're having, some way that they're contributing to what they're complaining about, that you actually have the basis for a therapeutic contract. So I hope this is important. Do not give short shrift to these, especially these character defenses, which again, left unattended, will prevent a therapeutic alliance, right? At best, you're going to have a collusive alliance, right, where you're colluding with allowing those defenses to stay in place as if you're doing therapy. Okay, so I hope this is helpful to you. Please send me your comments, questions, reflections. I'm doing this for you, so I want to make sure that it's actually helpful to you. Okay, thanks. Bye.